Started. Thank you for your patience. This meeting is being recorded and there will be a YouTube video of the recording later. So welcome, welcome. My name's Emily Kearns and I'm delighted to be with you this morning. I am the coordinator of Dementia Friendly Baltimore County. And this is the first session, first presentation in the 6-month series of Living with Dementia, the Dementia Roadmap series. And we know that dementia is a journey that's unique to each individual and each family, but there are similarities. There are choice points along the way that are similar for all. And along the way, to make those choices, we need resources. So over the past 2 years, the Dementia Friendly Initiatives leadership team has been working on a roadmap that pulls together dispersed dementia resources, puts them all in one place in this dementia roadmap. And so this series is a deep dive into each benchmark along the way in that dementia journey. You can find this roadmap on our website, and we are pulling it up right now. You can also get hard copies of this roadmap. If you would like hard copies, just reach out to our office so that you can help distribute them throughout the community, libraries, doctor's offices. But this is what one side of the roadmap looks like. You see, it's a pathway, the dementia pathway, and there are benches along the way. And these benches, as I mentioned, represent different choice points. For example, when should we get an assessment about what's going on with the changes we're seeing? Midway through the journey, you'll see a bench about assessing our living situation. Should we downsize? Should we get in-home services? You'll also see a bench around grief, another one around hospice. So this is the Dementia Journey Roadmap that was put together by our team. At each bench or benchmark, there is a database with resources available through the QR code or through the link. You can find this roadmap here on our website, Dementia Friendly Baltimore County. There are also videos that correspond to each benches, and you can see this pulled up on the screen here. I'm in that one video introducing the roadmap, and then we have our experts who will present throughout this series for each benchmark. So thank you for being here for the first bench, for the first presentation. And as you can see on that last screenshot, we have Stacy Young. You can find a short video where she's speaking. And then today we have the luxury and the delight of spending the next hour with Stacy. Stacy holds a bachelor's degree in psychology from the University of Maryland. She's also earned her master's degree in applied sociology and aging studies from UMBC. She's spent her career serving residents in nursing homes, assisted living, and retirement communities with a primary focus on lifestyle programming and dementia care. Stacy is also an activity consultant, dementia educator, and she holds several certifications in both areas. In addition to the work in her own community, she serves as an educator and consultant to communities within Maryland and the surrounding areas. Currently, Stacy serves as the director of the Center of Excellence in Dementia Care at Broadmead, a life plan community in Cockeysville, Maryland. Stacy has also served for many years on the board for the Maryland Activity Coordinator Society. And we are delighted to have Stacy as a member of the Leadership Action Team for this Dementia Friendly Baltimore County initiative. Without further delay, I introduce to you Stacy, and at the end, let me say, we'll have discussion and questions and answers. So please note your questions throughout Stacy's presentation. At the end, we'll open up for those. Please also put questions in the chat, and Ethel will help us track those questions and bring them to the discussion forum at the end. Also, I want to thank Ethel Rasmussen and her team at Baltimore County Department of Aging for all the support in this series. And Go ahead, Stacy. Thank you for being with us.
Emily, can you see my slides okay?
Yes.
Okay, thank you so much. I'm honored to be able to help get this roadmap series kicked off. And we really believe the starting bench of that is understanding memory changes, what is normal aging versus dementia, and what you all should know. So I am pleased and honored to be here today to share this first stop in that journey. And thank you for that great introduction, Emily. So if you looked at that roadmap that Emily had shared, our first bench, if you will, and actually we consider it really the gateway to the journey, is around understanding memory changes. You know, as Emily said, dementia is a journey. You know, we find that it's one with twists and turns where people share similar situations, even though their experiences can be very different. Some changes may be a normal part of the aging process, but some may start to point towards a memory challenge that you should be investigating and getting the support you need for. Education is really the key in knowing how to help yourself and help your loved ones and to figure out what to do about the concerns that you might be having. So we really think that that is that gateway to the journey that each person takes. Also recognize that every stop in the journey will be different for each person. So we do say that people should start to look at the stops and the journey pieces, not just when they need them, but all along the way, you should be understanding what might come next and be preparing ahead for what might come next. And that's what this map is all about. So understanding memory changes, this can be so difficult. Understanding, should I be concerned about what I'm seeing? Is this normal? You know, why are these things happening to me? You know, and as our journey stop says, memory loss and a waning cognitive function are common realities of aging. But where is that line between predictable decline and dementia drawn? You know, for example, if you forgot that there was a car due for an oil change, but you did remind yourself later, is that a concern? When you begin having problems digesting and retaining new information or completing complex tasks, or even exhibiting drastic and unexplained changes in mood, that's when it may become time to consider that possibility that this is more than just normal age-related changes. So today we want to discuss those things with you. We want to help you understand the difference and discover more about the prominent types of dementia and their symptoms that you might experience if this is what you're going through. First and foremost, this is a journey. It's a stair-step journey. You may go back down steps, go up steps, but at the end of the day, this is a journey we take together. It is not for the person living with memory challenges to do alone. It is for their care partners, their friends, their family to support them with, as well as professional providers who are out there to provide some of these special resources that you need. And that's what our map is highlighting. At every bench, we don't want you to feel alone. Part of the reason for the creation of the bench was that, or the roadmap, is that we know that a lot of times people will either be wondering about a diagnosis or maybe even after getting a diagnosis, they're left wondering, what do I do next? What's coming? And oftentimes you're not necessarily getting this information from the places you're visiting. They may say to you, we'll see you again if you have increased challenges, or we'll see you again in 1 year. But how do you bridge that gap between understanding I have this diagnosis and what do I do next? And that is why we have created this resource for you. So normal aging. I frequently say we're all aging, you know, from the time we're born. That's the one thing we all have in common is we're aging day by day. It looks different in our 20s than it does in our 40s, in our 60s, our 80s, but we are all experiencing aging changes that happen to all of us at various stages of our life. In normal aging, the individual may experience slower recall, they may forget parts of an event, but frequently, if given time later, they will often come up with that information or come up with the information to the level that they're able to complete the task or do what they need to do. In normal aging, most people are able to continue to follow spoken and written instructions. Sometimes we see in normal aging difficulty concentrating. I will be honest with you that I am in my 40s and I frequently share that I cannot concentrate the same way that I did in my 20s. In my 20s, distractions often didn't bother me, but in my 40s, that looks a little different. And as we continue to age, those distractions, noises, disruptions in the environment can make it even more difficult to concentrate. And then typically in normal aging, the capacity to learn may stay intact. However, new info may take longer to absorb. We may need to hear the details more than once to understand what we've heard or to follow the pattern of whatever is in front of us and to learn new things. However, typically with time and with patience in normal aging, I can continue to learn those new things. That's a little different than what happens in a true dementia. I don't know if you've heard the term mild cognitive impairment. I've been in the field for 25 years, and at the beginning of my career, this wasn't a term that was greatly used out there in the environment. It is a rather new term, maybe over the last 10, 15 years, to describe a condition in which a person's really starting to have some problems with memory, with language, or with another essential cognitive ability, whether it's learning new information, whether it's their judgment and their impulse control around what to do in their day-to-day interactions. These things will be noticeable enough that people are seeing it in you. And it may even show up on cognitive tests, but it's not severe enough to interfere with daily life. In the industry, we frequently see a lot of people living with mild cognitive impairment that are driving, that are living alone, that are still successful. But if you ask their friends and family, they're starting to notice some things. Maybe I'm forgetting appointments and I need several reminders. Maybe I forgot that I didn't take a shower today. Maybe I forgot that I already had breakfast. Things that are noticeable but aren't yet interfering with my ability to take care of my day-to-day life. About 10 to 20% of individuals 65 and older will have mild cognitive impairment. It's estimated that year over year, 15% of those individuals will progress from mild cognitive impairment to a dementia diagnosis. There are also a lot of things that we see that are what's called pseudo-dementias or reversible conditions, or they are conditions that are exacerbating an existing memory challenge, meaning I may have a memory challenge, but if these things are also present, they may make me look like I am more severely impaired than I am. This is one of the reasons that it's imperative to understand your memory changes, to understand what's going on, and to reach out to resources to have testing, evaluation, because you don't want to just assume, oh, I woke up today and this is my turn, I now have dementia. We want to make sure to rule out everything else before we assume that that is a new diagnosis. And again, even if there is a memory challenge, we want to help treat some of these things to help you be as successful as possible on your roadmap journey. Some things that are included: drug interactions and reactions. As we get older, we may take more and more medications, and with every new medication we add, that may interfere with the last medication that was on our list, or it may even just interfere with our chemical makeup within our bodies. If you woke up today and you were wildly different than you were yesterday, the first assumption wouldn't be that you just woke up overnight with dementia. We would want to look at some of these things to see, is something going on? Did you start a new medication that maybe is making that journey look different? Did you start a new medication last week and now the interaction of that getting into your system and working with the other medications may be causing a challenge? Emotional disorders, whether it's depression, anxiety, or other mental health disorders, these can greatly affect the way we present to society. Depression and dementia often go hand in hand in the sense that they can interact together, but also if somebody's experiencing a severe depression, that very much, if untreated, could look like dementia. So it's important to address those mental health concerns to put your best foot forward when it comes to your memory. One of the first things a physician would do is look at some of your lab work, including your thyroid. If you have severe hypothyroidism, this can certainly present with severe brain fog and confusion that could mimic or look like memory challenges. So that is one of the first things a physician might look at, in addition to other tests like vitamin D. Do you have deficiencies in other areas that may be causing that increased brain confusion and brain fog. Eyes and ears, we take them for granted. When our eyes and ears aren't working, this could very much look like a memory challenge. A fact for you is that research is now telling us that hearing impairment is the number one modifiable factor that could relate to an increased risk of developing dementia. Meaning, if I go for long periods of time with untreated hearing impairment loss that I'm not going to a physician about, I'm not getting those hearing aids or the aids that are going to help support that hearing loss, it can actually chemically alter our brain and therefore put us at greater risk of dementia. And they're actually telling us in our middle ages that we should really focus on our hearing health. And if health is damaged in that area, we should address it immediately. So we have to put our best foot forward to go to our audiologists, go to our opticians, make sure that our vision and our hearing are at the optimum level that is capable for us. We take this for granted, but none of us drink enough water. None of us eat sometimes the things we should be. And just simply having nutritional deficits or even just an electrolyte imbalance or dehydration could truly look like a memory impairment. One of the first things a physician might look at also is, do you have an infection? You know, are you dehydrated? Do you have a UTI from not drinking enough? These are things that might be reversible conditions that are making your journey look like you have a memory challenge. Brain tumors, brain trauma can also affect the way that our memory works. Infections like UTIs, COVID, pneumonia. It's really important to take good care of our physical health because as some of these viruses crop up as we age, the way they look in somebody that is aging looks different than maybe it looks like in a 20-year-old or a 15-year-old. And then certainly things like congestive heart failure. But even things that can affect our cognition that some people don't think about is anesthesia, surgery. Now, that's not to say we shouldn't get the surgeries that we need, but as we're aging, sometimes we need to look at that anesthetic and the factors it might play a role in terms of our cognition. Frequently, doctors will talk about the risk-benefit association, and oftentimes the benefit of the surgery is still very key, but recognizing how anesthesia can play a role. Other things like hydrocephalus, water on the brain, environmental changes, or even just moving or having different caregivers can cause extreme confusion for people. Moving is hard. I don't know if you've done it. I did it several years ago, and I say I'll never do it again, but it can be very hard to adjust to a move, and that's especially the case if I'm already experiencing memory changes. The reason we're here today, though, is to understand what if it's not just normal aging? What if I really think that it's gone beyond that? And I think this might be dementia. Well, again, when we discuss on our next roadmap series around understanding and getting evaluation, that is a key element to the journey that you're going to take and the journey you'll take with us in this roadmap series. We frequently talk about the fact that dementia is an umbrella term. So if you think of that umbrella as dementia, there are a lot of causes of dementia. They actually think that there's over 75 reversible and irreversible conditions that could relate to causing dementia. Some of the key ones that we think of are Alzheimer's disease. In society, oftentimes people think this is one and the same, meaning if you have dementia, you automatically have Alzheimer's disease. The reason that they tend to go hand in hand is Alzheimer's accounts for about 2/3 of all cases of dementia. So it is certainly the most prominent cause. But other causes could include vascular dementia, which happens from strokes and mini strokes. It's actually one of the few dementias that if you said someone woke up overnight completely different, that could be the case if somebody had a massive stroke or a mini stroke that changed their cognitive power overnight. Lewy body dementia. Lewy body dementia received prominent information out in society when we started to discuss the case of Robin Williams. After Robin Williams' death, his family released a documentary that speaks to his journey with Lewy body and what they went through prior to even knowing his diagnosis, which in their case wasn't until after he had passed. Frontotemporal dementia is a different type of dementia. Sometimes affects people in younger ages and affects other areas, not just their memory. And then others to consider are Huntington's disease, alcohol-related dementia. Some people with Parkinson's disease can experience a dementia diagnosis, and many others. And sometimes someone can experience what's called a mixed dementia. A mixed dementia is when the dementia has more than one cause. Sometimes we see people that will end up having Alzheimer's disease and vascular dementia, or two other ones that are combined. We want to thank our friends at the Alzheimer's Association because I think this display gives a great example of understanding dementia better. What I frequently share with the people that I get to educate is, think of it this way. You can have dementia and it might not be Alzheimer's disease. It might be one of these other causes listed here. But if you have Alzheimer's disease, then you do have dementia. Alzheimer's disease is one type. So how do we think about a dementia diagnosis? How do we even go about getting one? Well, dementia is classified as a neurocognitive disorder. And if a physician was to diagnose you with that, they would either categorize it as major or mild. The changes that occur directly correlate with changes occurring within the areas of the brain. I frequently stand on a soapbox to share that this disease is brain disease. And no one should feel guilty about the changes that they're experiencing. And every care partner should understand that the changes that the person in front of them is experiencing relates directly to damage that is taking place in their brain. This is brain disease. Each area of the brain has a job. And when this area is impacted, it affects how someone interacts with the world. A better display of that is this brain image here. You can see that we have various lobes of our brain, if you remember that from high school biology, and every part of our brain has a job. For example, our frontal lobe controls our thinking, our speaking, our memory, our movement, and one of its key responsibilities is our judgment and our impulse control. So if that area of the brain is affected, then we're going to see damages in our ways of interacting in the world in that regard. Maybe I make poor choices, or I do something that's dangerous, or I act in a manner that's not appropriate for the situation, but it's because my brain can't control the way that I'm interacting. Our temporal lobes control hearing, learning, and feelings. If I was in front of the caregivers here at Broadmead, I frequently make them do something to really help this sink in. Our left temporal lobe controls our everyday working language. Our right temporal lobe controls our rhythm and our patterns of speech. So think music, prayers, things that are very rhythmic. Our brainstem controls our breathing, heart rate, and temperature. If that's damaged, we might see some changes in that regard. Our parietal lobe there in the center is really our sensory center. It controls our language and our touch. The back of our brain, our occipital lobe, controls our vision and our color perception. So sometimes in certain dementias, we will see a complete change in vision that is not coming from our eyes, but from our brain. That's important to understand because, again, every part of the brain has a job. The cerebellum controls our balance and coordination. So think of the many changes we might hear about somebody experiencing in dementia. Again, if you think about this brain image, it's going to correlate directly back to some of these changes you've seen in this brain. What are the areas that can be affected? Well, language and communication. So in the beginning stages, we start to see what we call an aphasia, beginning to moderate stages. In the initial stages, we'll see what's called an expressive aphasia. That's my ability to understand what the person is, my ability to understand or say to you what I want to say. Frequently, they will lose nouns in those beginning stages. So think about if you went to have a conversation and you forgot how to say the noun, how difficult would that be to communicate with somebody? You know, in the later stages, if at all, they may develop what's called a receptive aphasia. So as we're experiencing memory changes, one of the things that might happen is we lose words. We lose the ability to complete full sentences to really convey a message that we're trying to say. And a tricky thing about the brain is sometimes it can make it hard for us to understand that that's what's happened. Meaning, I say something to you, it isn't a complete statement or sentence, but I don't necessarily know that I didn't tell you what I needed. So now what that creates is a level of frustration because I think I've conveyed a message and I wasn't able to convey it properly. So now I'm frustrated. Sometimes the people around me are also frustrated because they're just trying to help and they don't understand why I can't get my message across. Communication can be one of the biggest challenges that happen in memory changes. And it's also the area that we need to display the most patience, the most grace, and the most understanding of what somebody is experiencing. Learning ability. Fact for you that if I have a short-term memory impairment, meaning I don't remember what's just recently happened, it can be very difficult to get that information into my long-term memories, meaning it can be extremely hard in a memory change for me to learn new information. The one caveat to that is we do see where people can learn out of habit. That's called procedural memory. So in procedural memory, I can actually learn new things if I do it over and over and over again. Here in the continuing care retirement community world or the nursing home assisted living world, we will see where someone with a cognitive impairment can find their room if they move in as a new person that already has a dementia, if we continue over and over and over again to build that habit. Our frontal lobe controls our judgment and our impulse. If this is impaired, sometimes what we will see is we will see changes related to maybe my manners in a public setting. I may not understand the filters of what I'm supposed to do as appropriate action and not do. I may make unsafe decisions. Maybe a doctor has deemed I shouldn't drive, but if that car is available, I may still try to drive. Those types of judgment controls, what I frequently say is that frontal lobe, think of it like riding a horse. It's the reins of our brain. So the reins of the horse stop the horse. The reins of the brain are meant to stop us from maybe doing actions that aren't the most appropriate. When I say orientation, I don't mean a class like this. I mean orientation to our life around us. You know, that I understand that I live at Broadmead or in Hunt Valley or in Towson. I understand that it's the year 2025. I understand that it's heading into summer and getting warmer and I should dress as such. These things tend to start to be lost as we go through the journey of dementia. So I start to lose my orientation to the surroundings. I may get lost easily. I may even forget someone's name in my family or in my friend group, especially if I haven't seen them in some time or it's not information I'm used to seeing all of the time. One of the biggest changes we see is executive functioning, meaning my ability to plan out my day and to carry out the actions that my day require. Maybe I'm not able to manage my checkbook anymore. I'm getting lost when I'm driving. I forget about really important appointments. I forget I just spoke with my daughter and I try to call her again thinking we haven't spoken. Those are key examples of executive functioning, and that area can be a major concern as somebody continues to go through a memory change. And then certainly if parts of the body parts of the brain are affected that control my mobility or my physical needs, you might start to see balance and coordination challenges. You may start to see my ability to navigate my world on my own look different. Maybe I need therapy because I may start to need an adaptive device, you know, something that I may need to add to my daily routine to make my mobility and my life easier. I can't say it enough that dementia changes the brain. This is brain disease. So some of the things we see, you can see it very visibly on this slide. Look at the control case here on the left at the very top and the way the brain is operating if it was scanned versus what you see in the vascular dementia case. Similar to that right underneath, look at the areas of the brain that have become affected where those gaps lie for Alzheimer's disease versus the control subject with a quote unquote normal functioning brain. You can see similar images of this on the bottom. The reason I thought it was important to show this to you is I do think it's a striking example as you are navigating memory changes and as you are navigating with your family what comes next for you. We really have to consider that this is brain disease. And again, I ask you to give yourself grace and understanding, as well as giving grace to the person you're caring for that's going through this. We don't try to correct other diseases. And what I frequently say in our world is if somebody has a type 1 or type 2 diabetes, we're not walking around trying to boss their pancreas back into action. If they have heart disease, we're not walking around trying to bark at them to make sure that their heart starts to work the way that it should. But frequently, when somebody starts to experience memory changes, we will see where people will try to correct and make them go back to normal. And what I'm here to say to you is if there is an experience of a true dementia diagnosis, it's not as simple as just saying, you should be different. You know, why don't you remember? I just told you. I can't believe you don't remember this. We've talked about it 50 times. The person is going through memory challenges that may not help them understand that they don't remember that you just told them, or they don't remember that they had an appointment. They're not doing this on purpose. If I'm experiencing memory changes, what I frequently say is, I'm not giving you a difficult time. I'm having a difficult time. So as you're going through memory changes, or as the people you care for are, keep that in mind and keep this image in mind to tell you, don't forget, this is brain injury. This is brain trauma. And with every trauma you see, that is why you are seeing the symptoms in front of you. So you might say, okay, well, what do I do about it? Well, here at the Roadmap, we have offered you a variety of resources. And each time you join us for the series, you're going to learn more and more about how each journey on the Roadmap provides resources available for that direct category. So as we're thinking about memory changes, some of the resources we need to consider are finding a neurologist or a geriatrician near you to help with assessment. You know, starting with your primary physician, but advocate for yourself. You know, sometimes why we're existing as this roadmap is some primary physicians will say, oh, yes, you're experiencing a memory loss, but it won't change much right now. So just, continue to watch and we'll see you again in 1 year. If you think you're experiencing changes, advocate for yourself. Advocate that you would like to be assessed by a neurologist or a geriatrician or a neuropsychologist, as we use here at Broadmead, because they can really detail in assessments what might be taking place for you. They also can help to rule out some of those reversible conditions that we talked about. What I frequently hear from people is, I don't want to know. I'm here to tell you that, in my opinion, understanding the memory change is a key element to this journey, one which you have to be willing to explore. There are so many things that services and supports can do to make your life vibrant, active, healthy. If you are living with a dementia diagnosis, it's the difference between defining yourself by that or to think of yourself as, I'm just living with this diagnosis, just like I am everything else. These resources are going to help you live your best life with this journey. And getting that diagnosis, or even finding out you can rule out that diagnosis, is going to be a huge step in that journey that we do advocate that you follow. Looking at some of the 10 early signs of Alzheimer's and dementia, our friends at the Alzheimer's Association offer great resources around tip sheets, infographics, and things like that to make it really easy for you to understand, what are some of these signs I'm seeing and should I be worried? Resources on what dementia is, the causes, and more information on understanding memory changes that might be occurring. There's even some memory screening tools on our roadmap. You at home, if you're scared to go into that physician or you're not quite sure, you could use some of those memory screening tools to be a first step to help you or your loved one understand the memory changes that they're going through. And it's not all about getting a diagnosis or thinking about, what if I have this? but also being proactive. We have resources available on living well, keeping your brain active. Even if you are to experience a memory change, one of the things we know in the industry is the more that we actively use our brain and proactively do things like creating, doing crossword puzzles, keeping active in our lifestyle, engaging in social conversations with our friends, intellectually stimulating ourselves. While they won't always prevent dementia, what they do is create a very long term called neuroplasticity. It's a very fancy way of saying that the more we stretch our brains and use them, if we were to experience a dementia, our brain would be able to compensate for some of those losses in a better way. Also, keeping our cardiovascular health up. One of the key areas of research is not so much around doing brain exercises as it is doing exercises. Taking a walk, eating well, limiting alcohol, not smoking, things like that to keep ourselves active and healthy and try to prevent dementia and or to try to stave off some of the effects of that dementia. And then learning ahead about maximizing my independence. What we worry about is that people won't worry about the bench until they already needed the bench. We are trying to present the roadmap in a way that you recognize that you need to understand all the benches, not just the bench that you're at. And the best way to do that is to be proactive. The best way to maximize your independence and continue to live this journey exactly like you want is to really think ahead about what some of the resources are that are out there and be proactive in seeking those things that you need. You can see on this slide, and you will receive copies, that there's a link to our map that Emily and Ethel showed you at the beginning. These resources are listed under the Understanding Memory Changes section of the map. So thinking about more info on some of these resources, if you're saying, I want to understand what I'm seeing, what might be going on with me, the Alzheimer's Association has a 24/7 hotline. If you've already received a specific type of diagnosis of dementia, some of the associations that support are the Alzheimer's Association. If it's frontotemporal dementia, there's the Association of Frontotemporal Degeneration. The Lewy Body Dementia Association has what they call the Lewy line to help support. If you're looking for very specific support and diagnosis here in Maryland, one of the hallmark standards is Johns Hopkins Memory and Alzheimer's Treatment Center, which is housed at Bayview. And then certainly through our friends at Baltimore County Department of Aging and throughout the state of Maryland is Maryland Access Point. What I frequently say is, if you don't know who to call MAP, because they will help you out. Just like our roadmap is trying to help you along the journey, MAP from the Department of Aging can help you throughout the journey if you don't know where to turn. So what are your next steps if this is the bench that you're at in the journey? Well, the first and foremost is keeping the person experiencing memory challenges involved in the discussion. It is paramount to include the person living with dementia or living with memory change and not to step over them. I ask you, if that was you, wouldn't you want to be involved in discussions about yourself and not have people assume that you don't understand? As I said earlier in my presentation, receptive aphasia, or meaning my ability to understand what you're saying to me, that difficulty only develops in the later stages, if at all, in dementia. And so what I frequently say is all conversations should include the person all along the way. And if we truly feel like it can't, which may come at some of the later bench points, then the conversation shouldn't happen in front of them, because would we want to be talked about ourselves and about our care if we're not being able to be included? Have a family or care partner continue to have meetings and conversations with me along the journey. Let's stay informed together so that we can each help each other in this journey and this roadmap. Scheduling a medical assessment is paramount. Start with your primary physician or your geriatrician, and then certainly build up to a memory care clinic, neurologist, neuropsychologist that's going to really help you understand your diagnosis. They may even do brain scans to understand what parts of your brain may be damaged. That is a wonderful element in understanding what you might be experiencing. And what we frequently see is can offer some relief to feel like I'm not crazy. This is why this is happening to me. and also can be an area of education to family and friends to say, you know, this is where I'm impacted and this is why I'm doing the things I am, or this is why my loved one is. Please be patient. Contact local resources for support, whether it's our roadmap resources, whether it's resources that you've heard about from a trusted friend. It is important to get the support you need. Don't deny the memory changes and don't just ignore them. That is a recipe for disaster. Be proactive. Begin considering legal planning to be prepared for the future. One of the most damaging things we see in the industry is people frequently wait thinking they have time. Unfortunately, if somebody has a memory challenge, it can get to a point where their voice is no longer allowed to be heard when it comes to legal documentation if they've been deemed incapable. If it was me and I was experiencing memory changes, I would want to start to have discussions so that people know that my voice matters and what I have is the path in front of me. I want to have a say in what that looks like. And then certainly planning ahead. And that includes don't just attend today because you're starting to think about memory changes or you think your loved one has experienced it. Attend all of our future webinars or other education opportunities or support groups, memory cafes, to understand the different steps you might experience. Don't wait until you see the bench to sit down on the bench. You know, think about the benches ahead. Think about it like a hike. If you're taking a hike, you might prepare on the map for the journey ahead of you. You may look towards other points in the map so that you know what your landmarks are going to be. Think about those landmarks now. Don't wait until it's time to sit on that bench. So up next for us, on June 12th, we're excited that Christy, who's with us on the call today, will be our next leader of the next stop in the roadmap. That stop will be around the journey to clarity and really seeking evaluation, diagnosis, and support for dementia. You can see here, and as you get the packet, you'll be able to register just as you did for this session. But really, I encourage you, think ahead. Don't wait until you need to sit on that bench. So that is what we have for you. Emily and I are prepared now to have time for questions, thoughts, experiences that we may be able to support with.
Thank you, Stacy. That was just phenomenal, really substantive. And as Ethel has asked in the chat, someone has unmuted. As Ethel has asked in the chat, does anyone have questions or comments?
Can you hear me?
Hi, go ahead, please.
No. How do I access it? Oh, mute.
Oh, Charlie, I can hear you. Okay, go ahead, please. Charlie? I cannot hear you now, but I heard you before. While Charlie's figuring it out, is there anyone else who would like to comment or who has questions?
Go ahead, Charlie.
Can you hear me now? No.
Yes.
Yes, we can hear you.
Go ahead, Charlie, please. Charlie, do you have a comment or question?
Yes. The question is, our next session is the 12th or the 13th? The 12th.
It's Thursday, June 12th, Charlie, 11 o'clock.
Gotcha. Okay. Thank you. I got that. I'll have to figure out how to get on this better. And Ethel, thank you very much for trying, and who called me was really, it made me get on.
Excellent. Good to hear. Any other questions from the group?
This is Amy Gribop. I'm an elder law attorney, and I'd like to share. I really like the pseudo dementia slide, and thank you, Stacy. The presentation was awesome. What I wanted to add about the pseudo dementia slide was I had a client who had come in to update her documents because her spouse had gotten a dementia diagnosis. And what I found was she was under so much stress and so much grief with this huge change in her life with her husband. And I actually considered not doing estate planning documents because she was exhibiting signs of, severe cognitive decline. And what was interesting was when it ended up, her husband did pass soon after our first meeting. And once that occurred and she came back to meet with me, without stress, without the grief of what she was going through, cognitively, she was fine. And so just kind of, I think that another pseudo dementia issue is, somebody could be showing signs of severe memory issues when they're under extreme stress and dealing with grief.
That's absolutely true. We see sometimes what looks like dementia in a caregiver that's going through grief because something's happened. We see it sometimes just in the stress of day to day. We sometimes laugh it off, but because I work in the industry, in my building, I'll have people that I work with come to me and say, Stacy, I'm really worried. I think I might have dementia. Like, this is happening to me. But frequently what I'm hearing from them based on the symptoms they're describing, the experience they're having, is it really is that they're under severe distress. And we can only handle so much stress and so much opportunities like that or grief like that before it could look like we have dementia too. So that's why it really is important to rule out all of those other things that might be playing a role before we just assume it is dementia. So you absolutely make a very valid point.
Thank you, Amy. Let me weigh in too. And one of the things I'm learning in terms of the brain health, and others may add to this, is that I'm learning that Alzheimer's actually starts to affect the brain 20 to 30 years before it shows up. So in terms of what Stacy just said, in terms of stress day in, day out, over decades, it really can be affecting our brain's health before we even know it. And especially younger folks in their 30s and 40s, one of the things I say is that I know it's hard juggling family and work and bills and all that, but we must rest and have a healthy lifestyle when we're younger in those years, because the brain is preparing itself for the later years. And it's something I'm just learning that I think we need to emphasize, is because of the chronic stress that you talk about, both Amy and Stacy, can really impact the brain, and we don't know that it's happening. Thank you. Any other comments or questions? Great comment, Amy.
I did have a question. Are you going to, some of that material that you showed there, is that going to be sent to us by emails? It is.
Yes.
Thank you very
Ethel's
much.
going to send it out. And then, the key resources, that's the area where if you do go to the roadmap on the web, those links are all listed as well.
Okay, thank you. And do you work at Broadmead?
I do, yes.
Oh, okay. I've got a lot of friends up there.
Oh,
Okay.
great.
Anyone else? Anyone else want to comment? Have a question?
I don't have any questions in the chat to share.
Okay. Very good. Well, I guess I want to thank you all for joining, and Stacy, thank you for a magnificent and substantive presentation. Again, Ethel and your team, thank you for supporting today and the entire series. I hope all of the participants here can join us for the next one, which is June 12th. Again, this is a 6-month series, be held the second Thursday of every month, all the way through October. And again, if you want more resources, go to our website where you will find the map and the corresponding databases, resources for each bench or choice point along the way. With that, I hope you have a marvelous day. It's beautiful out, and enjoy.
Thank you.
Thank you.
Ethel has put that link to the website in the chat. Thank you very much.